sexuality is really important, and I know a lot of you work with other individuals with other neuromuscular diseases, and that's an area that I would encourage you to continue to explore, because that's something that families want to talk about, adolescents want to talk about with neuromuscular disease as well. So start having those conversations. So today we're going to talk a little bit about a clinical microsystems approach, and that's simply a quality improvement approach. And so when we talk about clinical microsystems, it's a particular framework in order to dive into all the different elements of care. We've heard so many conversations about collars, about respiratory care. How do you put all this together and adapt in your own environment? So I don't have any financial disclosures. I am from Chicago. I work for the Les Turner ALS Foundation, and we're a local organization, and we provide comprehensive care in Chicago. And our mission, again, is comprehensive care in order to help individuals navigate. And so navigation is a key term that everybody has been talking about today, as well as personalized approach towards that. And we also fund a multidisciplinary clinic and research, as well as a home team. So today we're going to cover the clinical microsystems framework as a model for the home and community. And I don't have the answers. I'm just providing you with a framework, and we're just starting to do that work. And so we'll keep it simple and focus just on the 5 Ps, which is an assessment, and I'll go through that. And then how the microsystems framework can be utilized in other organizations and other settings. So I have had the pleasure of working with Margie Godfrey at Dartmouth in the States. And I used to work at a pediatric hospital, and I was given this book. I don't know how to do the pointer. I was given this book, and they were like, okay, good luck, quality improvements, get on it, for the neuromuscular program. And it was just overwhelming. I had no idea how to dive into it. What do I look at? What does this mean? I'm just trying to establish relationships with a new clinic team. How does this work? And so it took a long time in order for me to understand what this framework was about. And so having an opportunity to actually go and visit a university and then eventually complete a course with I got to be part of the Scotland group, which was really great for me to learn about the health systems and to work through this process as I got a new job. And so Marjorie and her team has really built their work in partnership with a cystic fibrosis Foundation in the States, and they've done some really important groundbreaking work around developing guides and quality improvements and open research, and so comparison of different clinics, what are those outcomes, what are those metrics, how do we improve it, and they've looked at different learning and leadership collaborations. And so a lot of the materials today, I'm going to be talking about how to utilize that and adapt that. And this is really lovely for me to be here, because I think you guys are already doing this really important work. You're already asking those questions. You're part of it. And this is just an opportunity to reach out to your fellow colleagues in the quality improvement, if you're in an institution, those programs, and to utilize that. So essentially, a clinical microsystem is the building block. So it's where care is actually delivered. What does that look like? Where do those conversations take place? And for us, it takes place oftentimes in the home, and we'll talk a little bit more about that. So where is the real value add? We have a short time period that we're doing our assessments, that we're engaged and we're talking. So where can we make the most dramatic impact? And then this changes over time, right? You get new team members, new relationships, new personalities, and incorporation. And so how do you establish that? And so again, the microsystems framework has been grounding. So I'm not going to go into all the details about the various MAP. And so I joined Les Turner in January of last year. And so we focused our efforts this year on purely assessment, because there were some specific charges from the board of looking at our systems and how do we improve it. So I was very grateful to have this framework to start through that process. And so there's varying degrees. And we've heard about other folks' presentations about where they're at in testing different concepts and different ideas in the clinic and with their research. And so it's been, as you continue to do that, there's multiple frameworks associated with that. So again, these are just some of the tools that as you work through the microsystems framework, which is very similar to other systems, and this is just an opportunity to kind of step back before you start diving into the solution, right? So you might have seen a very interesting presentation that works really well in one country. Does this work with your framework? Does this work with your organization, your organizational goals? Is this in alignment with what your clinic team is trying to do? So it really starts with the assessment phase and then eventually working your way up and down the improvement map. And then as you're progressing through that map, it's going to be a roller coaster. It's going to be up and down, and you're going to be looking at different measurements and tracking. And so it's all part of this initial exploration to figure out what works. I think the one key piece that I wanted to mention as the last bullet point is around proactive conflict management, right? You're working with a group. We have encountered different personalities, different relationships, different goals about, and different theories about what's effective and what works and what doesn't. And as we are trying to develop those relationships, it really does impact care, as you're trying to work through those skills, and having a framework and an open dialogue can be really impactful in your quality improvement work. So our foundation in particular, because we fund a clinic, we send representatives, like many of you from foundations, we send representatives into the clinic to actually meet with the families and to have an opportunity to engage with them. And this is just kind of some of the steps. Our first step is the clinic. That's where we find out. And this is a lovely gentleman by the name of Daryl, and he highlights, we have a video on YouTube about what our care team does in the home and how we provide those services. So he had the opportunity, he met with Julie, and then the big question for us, as a foundation is, what supports do we give Easton and Julie before they walk into a home, right? What information do they need to know? Do they know? Because they are very experienced, very talented professionals who've been doing this a long time. Are there additional tools that they need in their toolbox? So, for example, if it's sexuality or additional methods to look at secretion management, what are the tools that they need to utilize in order to help drive some of those conversations? Our foundation does not provide direct care. We're advocates in the home, and so we work in partnership with the clinic team. And so a lot of our engagements are around supporting the person in their environment, the family in their environment, and I can't think of any more microsystem approach than having the honor and privilege to be in the home. And so we're just going to walk through two steps, and that is around forming your improvement team. And part of the work of the cystic fibrosis and other improvement work is around really engaging the patients and the families in the improvement work. And so some clinics I know have patient representatives who are part of their quality improvement work, who are engaged in assessing how the clinic's being run, really utilizing and being part of that actual team. So whether it's doing surveys or the actual patients sharing their viewpoints through directed conversations, and having an opportunity to do assessment. And so this is the place where you can identify what that looks like, and having families be engaged in quality improvements is really a critical piece. And having clear expectations around what you're trying to accomplish. And so there are the 5 Ps of assessing the services, and we'll talk a little bit more about those. Knowing your purpose, why does your program exist? What does the program mean to you? And I think that's very personal as you're trying to figure out, what motivates you as a professional, what are you most curious about? And then how is your particular project that you're interested in or you're wanting to have a better assessment of, how is that in alignment with the organization's goals? So, we talked a little bit about what the foundation is and, how our central purpose is around confidently navigating the disease and helping families and supporting them. So this is, again, some of the services that we do provide. And so, as a new person to the Les Turner ALS Foundation, it was really helpful for me to have a high-level view and to work with the team to be able to better understand what is our service delivery, how does that look, and what are all these pieces. It's quite daunting when you think about all the details involved in, getting equipment from one location to the other. As well. And so who are the people that you serve? I know sometimes, as you're pulling back and you're looking at, demographics and information, those are just numbers. And so what are the particular challenges in your geographic area? So, just like genes are unique, every person in a particular zip code and in their home environment and their relationship is really important. So identifying where your strengths and weaknesses are and how can you best serve the people that you actually are engaged with and working with. And how does the family view the care? So we talked a little bit about that. So I think it starts with listening and being in partnership with individuals with ALS and MND. I should have modified my slides. I thought of that last night because I just kept having ALS. And doing a high-level assessment. And I think, part of that work, and we've seen a lot of that, is around quality of life and how does that impact. We think we're doing good work, but how do we know we're doing good work in the home when there's no clear outcome metrics like there might be to be able to, judge the BMI and weight loss and things like that. But what are those metrics and what is the special sauce? How do we unpack it? What are we looking for? And so I'm just so grateful to be here to learn from all of you and the great work that you are doing around quality of life. And then the different associations and their reports that they've been producing to help engage and share what the individuals' voices are in the community, because we know there are many, many voices across the world. And I think this all has to be done with love, and Janet talks about direction. And I think as we're working together as a team to incorporate quality improvements and having the guidance and the compassion that we're all humans, and as we work through this process to better understand what the needs are of the community and where our gaps in knowledge are, and what we can do to optimize that. And then understand different roles. I mean, there's so many people that are engaged in care. Are you spending too much time filling out a form? Is there somebody else that's better suited to do that so you can really free yourself up? I know we all have clinical burdens that are mass and are very challenging to overcome, and actually having those conversations within your organizations, within your leadership, of identifying, can we change around some of these roles? How does this incorporate what keeps you motivated in doing this work? And thinking a little bit more about how do you actually collaborate? What does that look like? At Northwestern, we run the Les Turner ALS Center, and we have over 100 professionals that we are engaged with that are involved in the treatment and care of individuals with ALS, that it's outside of our organization. And so it's been very interesting as we've evolved this relationship. It's a constant renewal. You have new students, you have new nurses, you have new frameworks, new research, and so that's constantly diving into who are these people. Do we go out and share a drink after work and talk with each other? Do we know each other? And I think that's really important. Of course, the multidisciplinary approach, how are all these people working together? What does this look like? What does this mean? What in your particular environment, where are the opportunities? Where have people said that I wish my care providers were talking to each other? I wish I had the results sooner. I don't know why it's taking so long. You hear these things from families. And so diving into and doing an assessment can really help. So we have 8 nurses and social workers who are involved with our organization, and we do education, community education. And so it's not just the professionals who are engaged at the Les Turner Center, just like your centers, but also the vendors that you work with, the military associations that you work with, and what does that all look like, and how are we supporting the overall ecosystem? So how do you get things done? I mean, these are just questions for you to kind of think about as you're working through these processes. And I know these seem very Captain Obvious, this is stuff that we are thinking about, but having a framework really helps simplify and makes an assessment not as daunting. And so you can kind of dive through and understand a little bit more. What are these delays? How long does the care process take from start to finish to complete a task? And the other part of this is, as we reviewed some of our documentation, we knew as an organization that we didn't have the luxury of having all the data and the richness of some of the pieces, because we were a homegrown organization that started, doing good work in the field, but wasn't really capturing or telling that story. So, there's many methods that you can take. And so one of the opportunities that we did was we looked at some of the case notes, and we're able to identify some common themes that were coming up, the problem solving, the day-to-day needs, and the challenges with continuity of care is a very big challenge. And so how do you overcome that when you're working within a large system? And then in the US, it's very difficult to find access to affordable caregiving services, and that's where a lot of our time is spent. So again, it's going through this process and understanding, hi Sarah, and understanding what that looks like for us. And one of the big things that we were able to identify with our patterns is that we didn't have geographic alignment. So we had team members going all over Chicagoland, where now they're designated to a specific area, and that's really helped us because that impacts the overall mission if we're spending more dollars for mileage or not having a full understanding of that particular needs of that individual town or county. And so we also identified a need for new templates, and so we've created specific checkboxes to be able to have some more searchable data. And again, it's the performance and patterns and better understanding what are those metrics that actually matter for you. And so this is what we were just capturing, right? This is part of our annual report, but this doesn't tell the full story. So these are numbers, but they're not telling us the story. How are we doing our work? What does that look like? We have a patient assessment that they fill out, a satisfaction survey, but that wasn't really offering us the insights. And so, we're looking, and I'm very excited I met a lot of folks here that are doing some interesting work around assessment and to be able to incorporate that to have better understandings so that way we can have some of the lessons learned through that assessment. And again, this is just to show you some of the data, and what we learned is that we don't characterize our visits in the same manner, so we've identified the need to capture what our engagements actually are with families, and to actually define what the frequency of visits should look like and can look like, but allow flexibility because these are professionals. They understand the needs. Families were in the home every 6 to 10 weeks, sometimes more and sometimes less, depending on the needs and the identified needs in the family. But we knew that we needed to start to further define that and what our case management guidelines and roles were. And that was really evident when we started to dive in a little bit more with the literature. So again, this is the microsystem. You're going to go up and down and all around. And as you're starting some of your change ideas or are looking at new projects or bringing on new people that are interested, and this is a wonderful way for allied professionals to get engaged and help contribute to the literature and to really make some impacts on changes. So we talked a little bit about the 5 Ps and the framework, how critical that was. And that improvement is really an art and a science. And then we need to be able to have continuous open discussions and observations and seek out guidance to improve. You have to solicit encouragement using humble inquiry. I don't have the answers. That's what I always tell my team. I don't have the answers. We're going to figure this out. We're going to get messy together, just like the dance that you do with families as you're trying to figure out what is the best care plan. And it's really co-produced between the families, the professionals, the clinicians, and really having that true engagement. And I'm very honored to be a part of today, and I think that together we're going to really enhance and improve better patient outcomes if we start to better understand what is that sauce, what makes us unique, and how we can improve. Thank you.
Okay, we do have time for questioners. No questions. Again, I guess you explained it well. Okay. Wait, Laura, I have a question.
Boy.
So when you started looking at this, did you look at one, like say we wanted to go back, all right? Everyone wants to go back now and use this information. Do you just look at everything you're possibly doing?
No.
Okay.
Yeah. So no, we did it because we wanted a high level view. And so once you're in step one and you're looking at your team, so you want to know the people who are important to be part of that team. Various different levels. So that was one of the key take home is that it was a lot for the team to understand, and this was not a team that was well versed with quality improvements, and it was, thank you for asking this question, it was seen as threatening, and one of the opportunities that I wish I would have done better was to better set the stage that this is an open environment. How do we create that environment to have that engagement? And I think it has to be very specific micro movements in order to change the overall system.
Okay. Thank you.